I want you to walk to the nearest mirror right now. Turn on the brightest light you have. I want you to turn your head to the side and look very closely at your earlobe. Not the ear canal, not the top of the ear, but the soft, fleshy part at the bottom where you might wear an earring. Look at the skin. Is it smooth and round? Or do you see a distinct, deep line cutting diagonally across the lobe? It usually starts near the opening of the ear canal and runs downwards and backwards toward the edge of the earlobe. It looks like a permanent crease, a groove, or a deep wrinkle. It might be on one ear, or it might be on both. You might have noticed it years ago and thought nothing of it. You might have thought, well, I slept on my side wrong, or, it's just a wrinkle from getting older. I am here to tell you that this line on your ear is likely not a sleep wrinkle. It is not just a cosmetic flaw. It is a specific medical marker known as Frank's sign. And for over 40 years, cardiologists and researchers have known that this innocent-looking crease is statistically linked to a significantly higher risk of coronary artery disease, atherosclerosis, and silent heart attacks. It is one of the strangest, yet most reliable, external indicators of internal heart health. Your earlobe is trying to tell you something about your arteries. It is acting like a warning light on the dashboard of your car. Today, we are going to explore the mystery of Frank's sign. We are going to look at the science of why your ear would possibly be connected to your heart. We are going to explain the biology of end arteries and microcirculation. We are going to discuss why this crease appears, what it means if you have it, and most importantly, the specific medical tests you need to ask your doctor for if you find this mark on your body. By the end of this video, you will understand that your skin is a map of your internal health, and reading that map could save your life. To understand why a crease in your ear matters, we first have to go back to 1973. A doctor named Sanders T. Frank wrote a letter to the New England Journal of Medicine. He had noticed a pattern. He observed that many of his younger patients, those under 60, who were coming in with chest pain and blockages in their heart arteries also had this peculiar diagonal crease on their earlobes. He started checking everyone. The correlation was undeniable. This wasn't just a coincidence. Since then, dozens of studies involving thousands of patients have confirmed his observation. One massive study found that the presence of this crease was associated with a higher rate of cardiac events, regardless of other risk factors like age or smoking. In the autopsy room, medical examiners have found a strong correlation between the depth of the earlobe crease and the severity of plaque buildup in the coronary arteries. It is a physical sign of a systemic problem. But why? Why on earth would your earlobe wrinkle because your heart is sick? The answer lies in the anatomy of your blood vessels. Your earlobe is a unique piece of tissue. It contains no cartilage. It is made entirely of skin and adipose tissue, fat. It is fed by tiny, microscopic blood vessels called end arteries. These are the very last stops on the circulatory highway. There are no backup vessels to feed the earlobe if these tiny pipes get clogged. When you have generalized atherosclerosis, hardening of the arteries, it doesn't just happen in your heart. It happens everywhere. It happens in your legs, your brain, and your skin. Because the blood vessels in the earlobe are so small and delicate, they are often the first to suffer from poor circulation. If your blood is thick with cholesterol, or if your artery walls are stiff and inflamed, the blood flow to the earlobe decreases. When the earlobe doesn't get enough oxygen-rich blood, the tissue begins to atrophy. It begins to shrink. The elastic fibers, the elastin and collagen that keep your skin plump and smooth, start to break down and snap. This loss of elasticity causes the tissue to collapse along a diagonal line, creating the crease. So, Frank's sign is essentially a form of localized tissue death or degeneration caused by chronic lack of blood flow. It is the canary in the coal mine. If the tiny vessels in your ear are clogging up and dying, it is a very strong bet that the larger vessels in your coronary arteries are also struggling with plaque and inflammation. The ear is just the first place to show the cracks in the foundation. There is another theory that relates to embryology, how you were formed in the womb. It turns out that the heart and the earlobes develop from the same genetic material at the same time during fetal development. They share a genetic lineage. Therefore, a genetic predisposition to vascular weakness might show up in both the ear and the heart simultaneously. Regardless of whether it is circulation or genetics, the link is strong enough that insurance companies use to check for this sign when determining life insurance premiums. That is how statistically significant it is. Now, let's be precise about what you are looking for. Not every wrinkle is a Frank sign. As we age, we all get wrinkles. We lose collagen. Our faces sag. How do you tell the difference? A Frank sign is diagonal. It runs at a 45-degree angle. It is deep. It looks like a cut or a fold, not just a fine surface line. It often spans at least 1/3 of the distance across the earlobe. It is permanent. You cannot smooth it out by pulling on the skin gently. And crucially, check both ears. If you have the crease on just one ear, the correlation with heart disease is moderate. If you have it on both ears, bilateral, the correlation jumps significantly. Studies suggest that a bilateral crease has a much higher predictive value for severe coronary artery disease. I want to address the skeptics. You might be thinking, I sleep on my side. The pillow folds my ear. That's all it is. This is the most common objection. And yes, mechanical pressure can cause lines. But Frank's sign has been found in people who sleep on their backs. It has been found in populations across the world. The depth of the crease typically correlates with the severity of the heart disease. A shallow line might mean mild disease, a deep, trench-like line often correlates with severe blockages. Also, consider this, if it were just sleep, why does it appear diagonally? Why does it follow the vascular patterns? The sleep wrinkle theory has been largely debunked by the sheer volume of statistical evidence linking it to internal vascular health. So, you look in the mirror and you see the line. You see the diagonal crease on both ears. What do? First, do not panic. Do not call 911 unless you are having chest pain right now. Having the sign does not mean you are having a heart attack this second. It means you have a risk factor. It means you have a history of vascular stress. It is a call to action, not a death sentence. Your first step is to schedule a comprehensive physical with your primary care physician or a cardiologist. Do not just go in for a wellness check. Go in with a mission. Tell them, I have noticed physical signs that are linked to heart disease, and I want a full cardiovascular workup. Do not settle for just a basic cholesterol test. A basic test gives you total cholesterol, which tells you almost nothing. You need advanced lipid testing. Ask for ApoB, apolipoprotein B. This measures the number of particles that carry bad cholesterol. It is a much more accurate predictor of heart risk than just LDL. Ask for hsCRP, high-sensitivity C-reactive protein. This measures inflammation. Remember, the earlobe crease is caused by damage to the vessels. Inflammation is what causes that damage. You need to know if your body is on fire on the inside. Ask for Lp(a), lipoprotein a. This is a genetic, sticky type of cholesterol that causes blockages and is often resistant to diet and exercise. It is highly linked to early heart disease. And most importantly, ask for a CAC score, coronary artery calcium score. This is a CT scan of your heart. It takes 5 minutes. It looks for calcified plaque in your arteries. It gives you a score. A score of 0 is perfect. A score of 400 or higher is dangerous. If you have Frank's sign, this test will tell you definitively if the sign is telling the truth. It looks inside the pipes. While you are waiting for your appointment, you need to look at your lifestyle through the lens of your ear. That crease is telling you that your microcirculation is poor. Your blood is having trouble getting to the extremities. You need to open the pipes. The most powerful tool for this is nitric oxide. Nitric oxide is a gas produced by the lining of your blood vessels. It tells the muscles around the arteries to relax and dilate, open up. This lowers blood pressure and improves blood flow to tiny areas like the ear and the heart. As we age, we produce less nitric oxide. You can boost it with food. Beets and beetroot juice are the kings of nitric oxide. Arugula, spinach, and leafy greens are also packed with nitrates that your body converts into this gas. Adding a glass of beet juice or a large salad to your daily routine is like giving your arteries a sigh of relief. Then, look at collagen. The breakdown of the earlobe is a breakdown of collagen. Your arteries are also made of collagen. If your ear is losing structure, your arteries are likely becoming stiff and brittle. This stiffness leads to high blood pressure. You need to support your collagen production. Vitamin C is non-negotiable for this. You cannot build collagen without vitamin C. Are you eating enough citrus, peppers, and berries? Are you taking a supplement? Bone broth is another excellent source of the amino acids needed to repair the structural integrity of your tissues. We also need to talk about stress. Chronic stress constricts blood vessels. When you are stressed, your body pulls blood away from the non-essential areas like the skin and ears to feed the muscles. Chronic stress starves your earlobes. It accelerates the formation of the crease. Managing your cortisol levels through deep breathing, walking, or meditation is not just hippie stuff, it is vascular medicine. It keeps the peripheral blood vessels open. There is another partner to Frank's sign that you should check for while you are at the mirror. Look at your eyes. Do you see a gray or white ring around the colored part of your eye, the iris? We discussed this in another video. It is called arcus senilis. It is a deposit of cholesterol. If you have the earlobe crease and the gray ring around the eye, you have two independent, visible markers of heart disease. The statistical probability that you have clogged arteries is extremely high. You cannot ignore two red flags. I want to address the concept of false positives. Can you have the crease and have a healthy heart? Yes. Nothing in medicine is 100%. Some people just have wrinkly skin. Some people have collagen disorders that affect the skin but spare the heart. But you have to play the odds. The odds say that if you are over 60 and have this crease, you are at risk. It is better to get checked and find out your heart is fine than to ignore it and find out the hard way. Think of the crease as an invitation to investigate. It is an invitation to verify your health. Let's talk about the specific connection to diabetes. Frank's sign is also strongly correlated with type 2 diabetes. Why? Because high blood sugar acts like shards of glass in your blood vessels. It destroys the tiny capillaries. It destroys the end arteries. Diabetic patients often have poor circulation in their toes and fingers. The earlobe is no different. The crease can be a sign of long-term, perhaps undiagnosed, blood sugar damage. When you get your blood work, ensure your A1C is checked. You might be focusing on your heart, but the root cause might be your sugar. There is a psychological aspect to finding this sign. It can make you feel old. It can make you feel fragile. My body is marking me, you might think. But I want you to reframe this. Your body is loving you. Your body is communicating with you. It is giving you a heads up before the catastrophe. Most people don't get a warning sign for a heart attack until the chest pain starts. You have a visible warning sign that gives you time, months, years, to change your trajectory. You can change your diet. You can start walking. You can take statins if needed. You can reverse the plaque progression. The crease might not go away, the tissue damage is done, but the heart attack doesn't have to happen. Let's look at the mechanism of elastin degradation again because it explains why this happens to seniors. Elastin is the protein that allows your skin to snap back when you pinch it. In the arteries, elastin allows the vessel to expand with every heartbeat. If you lose elastin in your ear, causing the crease, you have likely lost elastin in your aorta, the main artery from the heart. This makes the aorta stiff. A stiff aorta causes high blood pressure, systolic hypertension. So, the ear crease is a proxy for arterial stiffness. This is why blood pressure management is the #1 priority if you have this sign. You cannot have stiff pipes and high pressure, that is how pipes burst. So, let's summarize the action plan for the Frank's sign protocol. The mirror check, do it today. Check both ears. Look for the diagonal, deep line. The context, are you over 60? Do you have high blood pressure? Do you smoke? Smoking destroys microcirculation and guarantees ear creases. The doctor, make the appointment. Do not be shy. Say, I read about Frank's sign and I have it. I want to check my heart health. The tests, lipid panel, advanced, CRP, A1C, and ask about the calcium score. The lifestyle, boost nitric oxide, beets/greens, boost vitamin C, manage stress, and walk every day to force blood into those tiny capillaries. I want to share a story about a patient, let's call him Bill. Bill was 64. He felt fine. He played golf. He went to the dermatologist for a spot on his nose. The dermatologist noticed the deep creases on both of Bill's earlobes. She mentioned it to him. Bill, you might want to see a cardiologist. Bill laughed. My ticker is fine. But he went, just to be safe. They did a stress test. He failed. They did an angiogram. He had a 90% blockage in his left anterior descending artery, the widowmaker. He had no symptoms. No pain. Just the ear crease. They put a stent in. Bill is alive today because a doctor looked at his ears. This is not superstition. It is observation. Medicine is the art of observation. We often spend so much time looking at our faces for vanity. We look for crow's feet. We look for frown lines. We try to erase them. But we ignore the lines that actually matter. The earlobe crease is not a vanity issue, it is a vascular issue. If you find the crease, do not run to a plastic surgeon to fill it with dermal filler. Hiding the sign does not fix the heart. That is like putting tape over the fuel gauge when it says empty. You need to fill the tank, not hide the gauge. Address the internal health, and let the ear be what it is, a badge of survival and a reminder to take care of yourself. This phenomenon is a reminder that the human body is a holistic system. Everything is connected. The toe bone is connected to the head bone, and the earlobe is connected to the heart. We cannot treat parts in isolation. So, take a look. Be brave. Be curious. If you see the sign, embrace it as information. Information is power. You have the power to change your future health. Your earlobe has done its job by warning you, now it is your turn to do your job and protect your heart. Thank you for listening. This is one of those small details that can make a massive difference. Share this with your friends. Look at their ears, discreetly. You might just spot something that saves a friend's life. Stay safe, stay observant, and keep your heart beating strong.